Hi, my name is Dan Ogilvie, and I'm the CEO of New Zone Medical. And I'm also the inventor of the dual air adjustable oral airway. And this is an educational video involving that airway. This is the airway you're used to using. It's 100 millimeters standard oral airway. And they say that everybody's the same. The dual air says we're all different. And so it has built-in customizable features. Standard airway measuring begins by corner of the mouth to the tip of the earlobe. But as I'll show you after our insertion phase, you can customize it for each and every patient. So now I'm going to begin the insertion phase. First I'll measure it. This is the 100 millimeter. And then I'm going to insert this. And it's not the same as it normally is. We're going to go in sideways, past the teeth with the palatal arch, and rotate it in 90 degrees. Now this is inserted in the patient now, but now is where I can adjust it to each and every patient. As I pull back, you can begin to see that it retracts the tongue forward, clearing the airway of each and every patient. What normally was a 100 millimeter measurement from the corner of the mouth to the earlobe now is at a 90 or 85 millimeters, pulling the tongue out of the airway, clearing the airway, and allowing for fabulous ventilation capabilities. This is the pediatric and adult oral pharyngeal airway. We have a large airway coming soon. The pediatric has the 50, 60, and 70 millimeter measurements with half steps, and the continuation of the 70, 80, and 90, and 100 millimeter measurements for the adult. The 70 millimeter continuation is for patients that don't quite fit the pediatric. The adult one will. The large opening in the center is for ventilation, but it also will allow a 14 French suction catheter down the middle to clear the secretions for a pediatric as well as an adult. The tab at the end allows you to pull this up and gives you more room within a mask so that you can extend this all the way out and use it in different features that I will show you later. Oxygenation of the patient is important. After insertion of the airway, clearing the airway, and adjusting the airway, now we begin bag valve mask ventilation. A lot of people want to know, how do I know that I have an appropriate clear airway? Well, if I put my mask on and I get good chest rise, chest expansion, then I've got a patent airway. If I don't, I may adjust it 5 more millimeter click, reattempt ventilation, checking chest expansion. Now, if the patient's level of consciousness improves, I can put on one of the newer simplified masks that give a variety of oxygen concentrations, or even a non-rebreather. The dual air adjustable oral airway is very adaptable. It has a Velcro head strap that attachment sites that allows hands-free monitoring of the patient. Its tongue deflector can be adjusted for the patient's level of consciousness. It can be pulled back into a bite lock phase, which looks something like this, for when a patient seizes. Now, if the patient's level of consciousness decreases, the oral airway can be withdrawn slightly, reinserted, adjusted for appropriate patent airway, and you can then ventilate the patient. I hope this educational video has been helpful for you. If you have any other questions or testimonials, please contact us at www.newzonemedical.com. www.nuzone, N-U-Z-O-N-E medical.com. Thank you very much.